Welcome to our discussion today on cross-contamination and fit testing. I'm joined by Dr. Stephanie Lynch here, our product manager at OHD. And my name is Luke Allen, president of OHD. And thank you for being here today as we discuss this topic. So really, Dr. Lynch, the reason we're doing another one of these is we have a ton of questions that continue to come in on cross-contamination, and also the guidance is ever changing. Our previous video, we were sitting right beside each other, and now we're in separate rooms and separate areas. So look forward to this discussion today and better understanding where we are at this point in time.
I think that's all really good. This is such an important question, and there have been just so many changes. Like you said, we did this in person, and before there were mandatory facial coverings for public being seen out in public. So there's several different things that people might be concerned about, particularly when it comes to fit testing and cross-contamination in the wake of COVID-19.
Absolutely. Yeah, so before we get started there, I'll mention that there's a great resource that you are a part of, safely re-implementing a respiratory protection program, which has a lot of components around fit testing, but even broader than that. So that is a resource that if you're watching this, you can check that out on our YouTube page or on our website. So with that, Dr. Lynch, where should we start with this discussion? Where's a good starting point?
Well, for me, I think that first and foremost, it's incredibly important to just note that because of how fit testing is performed, whether it's without the filters in place or with a probed respirator, then the user's not being protected, right? Their respirator is not a fully intact piece of their PPE. And then because of how, in particular, elastomeric respirators function, there's no filtration on that exhalation valve. So if there's a person standing in the room with them who's not wearing some sort of respiratory protection, then they're not being protected. So right. For these reasons, I think just upfront what we should say is that fit testing should only be being performed right now when it's necessary, and that the government has made some concessions for things like your annual testing being able to be postponed if you have issues with people coming in, or the actual things that are hindering your ability to safely and effectively perform your fit testing.
Sure.
I think that's just really important. It's also important to still follow whatever recommendations the CDC has in place. So currently things like wearing a facial covering if you're not able to socially distance appropriately. So for any aspect of the fit testing process, there's a lot more to fit testing than just that quantitative test, right? So for all those parts where you might need to, the people involved in the process could be wearing a facial covering, and then also to implement the social distancing, the physical distancing of at least 6 feet whenever you can. I mean, we're really lucky with the Quantifit that we can perform it in as open a space as possible in a bay or, anywhere where that physical distancing can be better implemented, right?
Yeah, so I think that is something that I was going to ask you about is like, what about in a fire bay or outside? We see that a lot in our user base, and maybe I guess this is a good time to rethink about where you're doing fit testing. So just because you've always done it in this room, maybe now you need to think about, well, should I be doing this in a more open area outside, wherever you have access to, because of the social distancing, and because I also think about the use case for us, Stephanie, and a lot of people watching this, it's not just the person you're fit testing, it's also the next person coming in to be fit tested, and so on and so forth. You could have multiple people moving throughout that process. So yeah, so outside, it sounds like that is something you would recommend if it's an option or in a bigger area.
Outside would be ideal. And just thinking about doing things like allowing a little bit of time between your participants, like you were mentioning, not having each person just step up right behind the next person, in a single file line, especially if you are unable to do that fit testing outside. But things like if you are inside, opening a window, all sorts of things that can improve that ventilation. So just a lot of I think sort of just a lot of planning, right? You have to think about it beforehand, lay out exactly how you're going to do things, and allowing yourself a little bit of flexibility, because we all know what happens when you make a plan.
Yeah,
But
exactly.
just plan for as much as you can, and have things to fall back on. But yes, outside would be ideal.
Yeah, and obviously not all fit testing technologies, qualitative, even quantitative, can be portable like that. So we want to, obviously, for our technology, it has a lot more options. You can open the windows, you can be in a bigger area, you can be outside. So that is a benefit if you're using technology that can allow for that. So what are, in your mind, what are some other concerns that people have, or what are we hearing there?
I think sort of one of the biggest ones is this idea that if you have an infected person come in to be fit tested, maybe, we keep hearing about these asymptomatic people, right? People who don't know they're infected and they're not showing any signs. Well, that then the inside of our adapter kits or our tubing or the machine itself could hold that contaminated air and pass it along to the next person tested. And I think it's just very important to understand, because of how we talked about how fit testing is performed and how a respirator functions, that's not going to be the type of that risk for cross-contamination is very minimal and comes way behind what your initial risk is, which is that exposure to that other person.
Okay.
Does that make sense?
Yeah, it does. So how just along that line, how do we know that risk is so low or is lower?
Well, so before and after our fit test, when the test subject is wearing the respirator, he or she is inhaling primarily through the inlets in our adapter kits. And then they're exhaling primarily freely through that exhalation valve of the respirator. Those adapters aren't made to just hold air. The moment you're going to disconnect them from the machine, they're then open to the environment. They don't just hold air.
Right. Yeah, and obviously one of the other difficulty things about doing a video like this. So again, if whoever's watching this, these are thoughts across a lot of different adapters setups. So every mask, we deal with a lot of respirators, a lot of companies. So there are different configurations, and we can help with case by case on that. But you're right, for the large majority, I mean, that's the way the air is meant to move throughout the mask. Exhalation goes out through the exhalation pathway.
Right.
Inhalation should be clean air from outside of the mask.
Clean air is the air from the room.
Right, exactly.
If we're having to assume that every user who's coming up could be infected, then you have to think about their exhaled air coming directly out of the respirator could contain contaminant. But so during the fit test, like you just mentioned, the user is inhaling the air from the room, the surrounding air. They're taking a breath and then they're holding their breath. So in an appropriate exercise, the Quantifit would then pull out what is that room air from the mask with its clear tubes, and all of that air goes in only one direction, which is going to ultimately be ejected out of the the exhaust port of the back of the Quantifit. Right. So throughout that, the Quantifit is doing what it does. It's measuring the pressure against that one-way flow. But it's just still important to know that room air could be possibly contaminated if you're assuming that every user who comes up may be infected.
Yeah, exactly. Or even the opposite.
We have to assume that in this environment.
Yeah, which goes back to the first point earlier, in larger rooms, outside, the best you can to kind of pre-plan for that, to try to reduce that.
Yes, so it's the circulation of that air that's diluting any contamination. Right. That's why we want to be out in these open spaces with as much ventilation as possible.
Sure. So you just touched on the exhaust port. So one of the things that we've had questions about is, should we filter the exhaust out of the instrument? And you were talking about that one-way flow. Can you kind of expand on that really quickly so we can cover that for some of our users?
Well, I can, and I do think it's still, I hate to, just keep reiterating the same thing, but it's about evaluating where the risk really is. So this, again, very minimal risk, but there would be no problem with you filtering that. You don't want the filter to be too small or become restrictive of the air, right? Because that could create problems with how the instrument is actually functioning. And if you want to avoid that, but you are dead set on getting a filter, then we can actually install a HEPA filter if needed. And that's at a very nominal fee, just the cost of materials. But thinking of where your risk is, there's exposure to that operator, because if that user is infected, their contaminated air is being freely exhausted into the room, right? But there's minimal risk of contaminated air being pulled in and contaminant somehow suspending and making its way all the way through the tubes, through this turbulent process in the machine, and then out the back of the machine. Especially if we think about a well ventilated space, right, that would be further diluting that air. So when you hear experts talking about, and I don't want to claim to be an expert in virology, but when you hear experts talk about the ability of the virus to remain in the air, they're talking about still air.
Yeah, like stagnant air.
Right. So when we pull that air from a fit test and run it through a system, the vast majority of any sort of particulate that would be suspended in there is going to become impacted on, some surface to then become surface contaminant. And if that surface contaminant is somehow trapped in the inside of the machine, it's not going to be contacted.
Right.
So,
and one thing that I think people kind of forget about, or maybe not forget about, but it just loses itself, is that air pulled through the machine, it comes out the exhaust port. If it does come from the individual in the mask somehow, that same individual is also breathing in the room, which you talked about earlier, which is going to be a much larger amount of contaminant, because it's breathing out of either the exhalation valve of the mask, or when they take the mask off after fit testing, they're breathing freely in the room, and then they're putting a facial covering on or whatever. So that really is the larger threat when it comes to fit testing. It's not really what comes out the exhaust port. Although that is good that you've kind of touched on that, but that we try to help people understand the larger threat, which you mentioned earlier about the room environment. So
the threat is other people. And so that's why you do want to still take these steps. Like we said, with the Quantifit, you're going to have that ability to have that physical distance, the appropriate physical distancing. But then, like you just mentioned, if someone goes, they're taking off their respirator, well, have them go ahead and at that point, reapply their facial covering, anything you can do to minimize your risk, as I'm speaking as a fit test operator, or to minimize the risk of subsequent subjects who might be coming up. Yeah. So
you did mention the dual tube side, the two clears tubes. The blue tube, that is something that people might not be fully aware of what it does. You want to just spend a couple seconds on the function and how there's really no issues there from a contamination standpoint?
That is a really good point. The blue tube that connects to the valve pump, what it does is actually push air in a positive pressure, but it pushes onto a diaphragm that's within the adapter, so that the respirator can become airtight. So that air from that pump never enters the mask. It's simply pushing on a diaphragm. So that air is no risk whatsoever.
Yeah, and I think a lot of people understand that, but just while we're doing this video, we just cover that too. So so let's move from those tubes into the adapters now. So what about questions we've heard about exhausted air contacting the adapters during just normal breathing, or during a fit test? Kind of talk around that.
So that's going to bring us to this idea of surface contamination, right?
Yep.
If you're going to have to assume that everyone's infected, then basically all the surfaces that have been around that person or these people, you have to assume that they may have been contaminated. So this is going to include the mask that they were wearing. This is going to include the adapter kits that they were using. This is going to include that tubing. It's going to include the machine itself. Anything that is common in the area, the desk that is in front of them that the machine is sitting on, anything they may have touched. If you have people signing in, you may want to think about utilizing a different process for that doesn't have the common PIN, or we have to just think about a lot of things that maybe we didn't used to have to think about. But so if there's that threat of contamination, and there is, then you want to make sure that you wipe down all those common surfaces in between each subject. And like we mentioned a little bit earlier, just allow for some time, have a subject come up, use that time to maybe clean the space, and that allows for some fresh air to come through, and just anything you can do to minimize that risk.
Yeah, that's very good, and you probably will see your timing in fit testing adjusted when you talk about scheduling people and all that. It's not going to be like it was, earlier this year, really, or last year or previous years. What about some precautions around, or just some advice that you would give around screening or preparing for people coming in? I know that's something that we get questions a lot about. Just any input on that?
I would just think that because there is that risk, and the risk is other people, you can kind of assume that with the way fit testing is going to be run now, that fit test operator is going to end up having the most exposure, right, of each subject coming up and being fit tested. So they're going to want to take extra precaution. You would want to have some sort of COVID health screening in place. If any test subject were to self-report any exposure or show absolutely any signs of sickness, then that fit test should be postponed.
Sure.
Like we've mentioned repeatedly, but it's worth mentioning again, that operator should maintain that 6 feet distance, at least 6 feet distance from all of those being tested. Your facial coverings should be worn whenever possible. So you want to do it in open space. You want to clean and disinfect all of your common things, including your instrument, wiping off your adapters, wiping off your tubing. If you want to clean those tubes in an abundance of caution, same with the adapters, you can submerge them. You're going to want to submerge them in an EPA-approved disinfectant, which I'm sure we have the link to that in our video. I'm sure we can include it in this one. And the tubes and adapters, one thing important with that is to remember that they're going to need to be completely dry before you utilize them again in a subsequent fit test. So you might have to have a couple of sets that you need to rotate through. If you're not doing that, if you're not submerging them, then just make sure to wipe them off. You as the fit tester should make sure that you're washing your hands often with soap and water, using gloves where necessary, and doing the appropriate procedures of disposing of those gloves and putting on new gloves between subjects. Avoid touching your eyes, nose, and mouth. You may also want to wear your own respiratory protection. I've mentioned to you and several people here that if it were me, I'm going to be in my full face respirator, just because I have a really bad problem with touching my eyes, nose, my face. So that's going to become a little bit contingent on my level of confidence that I'm not infected, right?
Sure.
But I think you could do that. And then once you were sure that you weren't part of the problem, then by protecting yourself with that level of protection, you could just have maybe a little bit more ease. And that's just my personal opinion, but just whatever you could do to protect yourself.
Yeah, those are good. Those are good pieces of advice. And yeah, I think right now everybody's doing the best they can. I know you mentioned at the beginning, I mean, we're not experts in, how viruses travel or move. So what we're doing is taking the best guidance from the CDC, our knowledge of our instrument and technology, and trying to merge those together. So I guess with that, any closing thoughts from your perspective, and then also for people to kind of understand this video is in that context, that we did it today, and tomorrow there could be new information out there on COVID-19. I'm sure there will be. Any closing thoughts or topics around that?
Well, I think that would just be the closing thought, right? We don't really know what tomorrow may bring when it comes to this situation. So keep up to date with the guidance that's being put out in your local community as well as by the CDC, and yeah, the latest research from experts, and we just want everyone to stay healthy and safe.
Yeah, absolutely. Well, thanks for joining us today, Dr. Lynch, and thank you for watching this. Hopefully it's been educational and gives you some confidence in doing your fit testing. We're here to support you. So if this video didn't cover topics that you have questions about, please feel free to reach out to us. Our sales staff or also our technical support staff. And we look forward to working with you as you get back into fit testing or continue that process now. So thank you for joining us.
Thank you, Luke. Nice to see you.
Yeah, good to see you as well. All right, thank you.